Have you ever felt overwhelmed at all the different treatments for depression out there? In this episode, I'll give you a quick overview of 10 of the most common options you may find. Stay tuned. Hey guys, my name is Piper, and this is Real Talk Mental Health in Vancouver, Washington, where we talk about real-life mental health issues from the provider's perspective. If this is something you're interested in, be sure to check out our other videos, and make sure to click that subscribe button and the notification bell so you'll know when we put out new videos. Let's get started. In previous episodes, we started talking about the process of dealing with depression. Things like developing a consistent and healthy routine, being proactive against symptoms, and not letting up. Without that foundation, treatment results will only be partially effective. Depression is a complex medical condition that might require many different treatment approaches in addition to basic lifestyle changes. Today, I'll give you an overview of the top 10 treatment options that you may need to consider in treating depression. They're in no particular order. We just want to make sure that you have all the information. The first one I want to talk about is therapy. CBT, DBT, ACT, EMDR. You've probably heard these acronyms. They're different styles of therapy. Now remember, finding a therapist is a challenge at times. Finding the right person that does the right type of therapy and the right environment for you, that may be driving distance at an appropriate time. I mean, sometimes it just feels really challenging to find all of that to come together. And that's pretty normal. What I would encourage you to do is not give up. Keep trying, talking with those therapists. Sometimes even therapists will allow you to have a free 5 to 10 minute call, and you might really consider doing that to kind of get a feel for if you guys vibe together. There's also group therapy and different psychodynamic therapies. There's all sorts of different types of therapy out there, and so just know that there's a fit for you. Therapy is often the foundation to almost every mental health treatment modality. That therapy in itself can sometimes pose challenges if you have a chemical issue or a nutritional issue or sleep issues, but just know that therapy is always going to be a part of the treatment plan. And studies have shown that a mix of therapy and medications is often the most effective form of treatment. Now, the next is nutrition and activity. So, we all talk about you are what you eat, right? And changing nutrition and diets is really challenging when you're depressed. It sometimes just feels like a mountain that's so difficult to climb. But small changes can make a huge difference. And sometimes hiring a nutritionist and getting tested for food allergies, making sure that you're ruling out celiacs or any issue with certain types of food that might be causing inflammation or GI issues or stomach upset can make a really big difference in depression. Now remember that gut health is vital to mental health because a lot of serotonin is produced in our gut. So if our guts are not healthy, oftentimes we're not going to get the neurotransmitter production that we want. And so it's really important to really have nutrition as part of your routine, and being able to make those small changes makes a huge difference. I would encourage you not to have any type of extreme diet. They're often not sustainable, and frankly, they're not always effective for everyone and can be very discouraging when you gain all your weight back. So I now want to talk about supplements. So supplements are a whole different game plan and a whole ball of wax, so to speak. Now supplements, I'm referring to those that you'll find from naturopaths. There's a lot of vitamin stores. I mean, everyone seems to be having an opinion about supplements. I would say that at the most basic level, the typical supplements that we'll find for depression will be vitamin D, vitamin B, and B complex, so all types of B vitamins. Tyrosine is very common. You'll often hear St. John's wort. I would caution you on St. John's wort. There's often a lot of drug-drug interactions, and we have concerns about that happening frequently and putting you at risk for serotonin syndrome or other things, and so I would encourage you to limit that. You might hear about 5-HTP, which is a precursor to serotonin. Oftentimes, most patients and clients are more comfortable with supplements than they are medication. That's a fairly normal experience. But just know that not all supplements are FDA studied or cleared. And often, they don't meet the same rigorous standards and that medications do with, double-blind, placebo-controlled studies. Now Naturopaths are very intelligent, they're very resourceful, they're fantastic resources for information. I would encourage you, if supplements are something that are very important to you, that you meet with a professional and be able to figure out how to include supplements into your treatment path. Now, even if supplements are not enough and you are ready to take the next step toward medications, it doesn't mean that supplements can't have a place in your treatment plan. It just may not be the whole treatment plan. So as we go through all these options, I will continually say that there's usually never one treatment way to get the results that you want for depression. So it's important to remember that it might just be a mix of many of these options. Now next, let's talk about medications. So medications are something that we hear a lot about. So, acronyms you might hear are SSRIs, SNRIs, NDRIs, atypical antipsychotics, mood stabilizers, benzodiazepines sometimes. And in all these different acronyms, they all have different functions. So an SSRI is a selective serotonin reuptake inhibitor. SNRI would be serotonin norepinephrine reuptake inhibitor. NDRI is norepinephrine dopamine reuptake inhibitor. So understand that within each class of these medications, there's many to choose from. And this is where it takes a specialist to really understand the mix of medications and understanding what med fits you best. Now, even with an expert in psychiatry, whether it's a psychiatrist or a psychiatric mental health nurse practitioner, understand that everybody's body is different. We all metabolize differently, we have different sensitivities, and so sometimes in a sense, it can be a trial and error in some respects. Some of our clients complain, I don't want to feel like a guinea pig, and I feel you on that. I think as a provider, if we were able to choose the right med the first time, we would 100% do that. So know that we are motivated to make sure that we get you to your best self as fast as possible. We really don't have an investment on you being ill. We want you better. It makes us thrive as providers as well. There's plenty of business to go around. We don't need sick clients. And I really don't think we could feel like we're making a difference if people didn't get better. So know that when I talk about medications, again, I don't want you to ever think that medications are the only answer or all of the answer, but they often are integral in beating depression and getting toward that remission goal, which many clients have. Now, within these families of medications, understand that there's lots within that family. So an SSRI, for example, might have Zoloft, or sertraline is a generic name, Lexapro or escitalopram, Celexa, citalopram, fluoxetine, which is Prozac. You'll likely have heard of these chemicals, right? And it takes a process to start the medication, taper up, make sure you can tolerate it, make sure it's effective. So it's a pretty long process for some people. Other people, they get results quickly within 10 days. And it can be pretty magical for some people and also pretty frustrating. Just know this is a process, and you want to make sure you have a provider that you trust, that you view that they're a team member with you, you feel heard, and you can make changes together. So medications, I would encourage you to understand that they're often vital in your success, and making sure that we find the right med at the right dose with limited side effects, and making sure that we're not under-treating you as well, because we want to get you to that place of stability and remission if that is your goal. Now, after you've tried medications and you're looking for other options, you might go into more what we consider alternative treatments at times. The first one may be alpha stim. You might hear of the Fisher-Wallace device. And so, this is using brain stimulation. Now, this is different than TMS. Now, TMS is transcranial magnetic stimulation. So understand that it's sometimes hard to navigate all the treatment options, but know that there is plenty. Now, alpha stim is sometimes covered by insurance, sometimes not. TMS now at this point is covered by a majority of insurers, including Medicare and Medicaid. Now, TMS has been around since the 80s. It is very well studied, very robust, very effective. And TMS is something that has come to the States, since 2008. and it has exploded in growth because of the efficacy. Oftentimes we see response rates as high as 70% of people respond, and remission rates can be as good as anywhere between 38 and 50%. Now, when we're talking in mental health terms, in remission rates, 50% is astronomical. It is amazing to think that, half of our patients, if not more, could reach remission. That's an incredible, incredible thing. Now, other options that you may explore outside of alpha-stim and then TMS, a big thing in the news is Spravato or even ketamine IV. So Spravato is S-ketamine, it's a nasal spray, and ketamine is an IV. And ketamine's been around IV for quite a while, again, not covered by insurance and quite cost prohibitive most of the time. Spravato is a nasal spray and has been covered by most insurance plans. And it targets glutamate in the brain. There's some really fascinating research coming out, and we're finding, and learning with, having patients and more patients receive this treatment about how powerful Spravato can really be. It's indicated in depression and for suicidality at this point. We're really excited to kind of see what comes from Spravato long term. Now, one of the tried and true treatments that have been around for, eons is ECT, or electroshock therapy. Now, people often feel like that's archaic or it's not in use, when in fact it's still the gold standard for severe treatment-resistant depression. It does come with its risks. It requires anesthesia, and it can cause memory loss, and has some big-time side effects that not everyone's ready to take on. And because of that, it's often the last resort for a lot of people. The great thing about TMS is that you can drive to your visit and drive home. There's no anesthesia required. Now, Spravato does not allow you to drive. You do have to get a ride. So, as you tend to get further into your treatment for depression, they sometimes can get more invasive and can be more impactful on your life, but also the results can be much, much higher, which is a really special thing. And then lastly, I want to talk about a really exciting thing in mental health, and that's psychedelics. This is something that's been in the news and politically has been sometimes charged on either end, but there's some pretty significant movement in regards to psychedelics. So we're really excited to see what comes from this. There's some really promising data out there. You may hear of implantable devices such as the vagus nerve stimulator or the deep brain stimulator, and these involve surgical procedures to implant that electrical pulse generator. The goal of that, of course, is to increase firing of the brain's neurons. So, in all of the treatment that we just talked about, I think that what the big takeaway here is understanding that there's so much to choose from, right? So this may mean that it's going to take time to find the most effective treatment for you. Know that your situation is not hopeless, that these treatments are not just nice ideas, they are treatments shown to be effective in clinical studies. There are ways to bolster yourself through this process, including adding physical activity, doing your best to eat well and sleep well, maintaining a social life, reaching out to your support system. Those are all very important. And as you can see, there's many options, so please don't lose hope. You still have to show up every day to day, put that one foot in front of another, and just keep going. Keep trying. It's like a Rubik's Cube. Sometimes you have to find the right combination for you. And when that comes together, it feels wonderful. The good news is that most people are really resilient, and we can get through a lot as people, and sometimes we don't give ourselves enough credit for that. Sometimes it's just about finding the right treatment with the right provider that makes all the difference. Thank you so much for watching this video on how to beat your depression. If this applies to you, or if you feel like you've been struggling to beat your depression and you're ready to get some help, please reach out to your local mental health specialist. And if you are in the Vancouver, Washington or Portland, Oregon area, reach out to us. We are here to help you in your fight against depression and help you get your life back. See you next time.